Today, we're going to talk about supplements, IV therapy, and of course, hyperbaric oxygen therapy. So we're going to start with IVs, and IV therapy is being offered at many clinics right now. I guess all integrative clinics in some way or another offer IV therapy. They might also offer hyperbaric oxygen therapy. And these two could be combined in a way that they have synergistic effects. So they potentiate the effects of one another, but you need to know how to combine them. So that's my first question. How do you combine these two?
Yeah, that's it. Well, first, thank you for having me on. Always fun to talk. Yeah, I think, maybe I think the percentage of integrative clinics that do some sort of IV therapy is very high. I don't know it's 100%, but it's pretty high. And the percentage of integrative clinics that are doing more hyperbaric work is growing all the time, as we know. So I think we see these two coming together. In our clinic, where we've done hyperbaric for over 10 years, and we've done IV therapy for 30 years, we've been using them together for a long, long time. And because I have the privilege sometimes of teaching doctors and other integrative care folks about IV therapy, we more commonly will include a little sort of module on, well, what if I'm doing hyperbaric and then an IV therapy? Is there an optimum way to say, combine to get synergy? And so I think that the best way to describe it, because there's kind of, when you get to IV therapy, because unlike taking a pill, the IV, the nutrients are immediately inside your bloodstream. So, it's 100% absorption. It's right inside your bloodstream. And so you have more, in a sense, control over the dose, but also you have control over when is that material going to be percolating through my body, and going to my brain and my liver and everywhere else. So IV is nice in that sense. So the way that we do it, and I'll explain why there's sort of two pathways. The outcome that we want the hyperbaric to synergize, or the outcome that we're adding the hyperbaric to try and gain, is what dictates which direction we go with combining an IV therapy with hyperbaric. The hyperbaric may be the same on each direction. And that's one of the really nice things about hyperbaric, is it can synergize in a particular direction for a type of condition, and it can synergize in a different direction for other types of condition. And the problems that, not problems, but the confusion that comes up a lot of times is, often you'll get a clinic that maybe has done IVs for a long time, and then they get, they start doing hyperbaric, or they have a hyperbaric clinic move in next door, and they're sharing patients, but neither one has managed the two together, right? So to make it as straightforward as possible, I'll kind of tell this through the eyes of two different patient types. So the first question, though, and this has to do with a large number of things, but mostly chemistry and comfort for the patient. The first question that the practitioners and usually the patients want to know about is, do I have to say get the IV and then get right in the chamber? Okay. Or do I have to have the IV inside the chamber? Or can I do my dive, my HBOT dive, and then have the IV after? Now, chemically speaking, it almost doesn't matter, as long as you're, like in our clinic, they're in the same space. So of course they're very close. If you're going to drive, just across town, and it's half hour, something like that, that's close enough also. So if you're within a proximity of time between the IV and the hyperbaric, it really doesn't matter that much whether you do it before or after. We have experimented early on with IVs in the hyperbaric chamber. There are reasons, there's nothing wrong with doing that, but it's difficult. And there's no compelling reason to go through the difficulty of doing that because it doesn't improve the outcome really to do it. In the beginning, we thought we might have to do that. So what we tell patients is, because there's not a big difference of doing the IV before your dive or after your dive, and because of your bladder and you being stuck inside of a hyperbaric chamber, what we prefer to do is we'll get you in the chamber, we'll do whatever protocol we're going to do with the chamber, and as soon as you get out, you can go to the restroom, empty your bladder, we hook you up to the IV, and I guarantee that during the IV, you're going to probably need to go to the bathroom once or twice more, right? So unless somebody wants to make sure that they have urinals in the chamber and all of that stuff, it is unwise to do the IV before you get in the chamber. Now, I would not be so maybe dogmatic about this if I didn't practice this and do this for so long, but I've heard people theoretically say that, well, with certain therapies, you're better. It's way better if the IV goes in first, and then you put them in the chamber and send them in with a urinal or whatever. If you want to do that, that's fine. There's an issue though of what if the urinal doesn't work or other things, right? It's not that it is a theoretical difference. There is not that much difference pre and post. Okay. And so when I do my next step and I tell you the two different patient directions that we use this with, I can tell you definitely from patient outcomes that we see just as good outcomes, but whether we do the IV before or after, but the patients are much more comfortable. So it's HBOT dive first, then IV. Okay. So that's the first thing. And that's just a lot kinder to people because then they have access to the bathroom. But the two directions that you go with nutrients IV or similar would be, if I have an injury that I am trying to help someone heal from, so they just got in a car crash, they've got a TBI, they just had surgery. We were across the road from a really big oral surgery center, and every now and then things are so complicated they'll transect a nerve, in surgery, and the surgeons got on the idea of doing hyperbaric, and so they would send their patients over, and they'd have these amazing recovery, with the hyperbaric. And so we talked to surgeons and said, hey, what we are finding with injuries is the hyperbaric's awesome. If we give some healing-oriented nutrition intravenously, it's even faster and better.
Could you give me an example? That's really interesting. I didn't even say anything because I was all ears listening. But could you give an example of that healing IV that you're referring to?
Yeah, I'm working up to that because the IV is the different variable between what you're trying to do. So the other direction, though, just so you know what we're contrasting, is, let's say I'm not trying to heal an injury, okay, or a surgical damage, something like that, but I'm treating something like cancer or a very aggressive infection, or maybe even just a very aggressive acute infection, okay? That IV is going to be completely different and chemically completely different than the one on the injury side, okay? So on the injury side, what we want them to do is to get the hyperbaric benefit of high oxygenation and plasma saturation, all of the good things that hyperbaric does. And then what we want to do is to put a mixed vitamin and mineral nutrient IV in. Most of the vitamin minerals are going to have two purposes, though. They're, number one, they are going to be used in the process of tissue healing, okay, because our body obviously uses nutrients to remake ourselves when we hurt ourselves. So that's a big part. But the other part is they're going to either get 2 IVs or 3 IVs in an injury situation, okay? So the first one's going to be the nutrients that are going to help with rebuilding and repair. Also, though, as it would happen, your body also uses those same nutrients to support a really important antioxidant called glutathione that we use inside the body. So the next, which is a shorter IV, is glutathione you get after those nutrients. And what we found long time ago when I was doing cancer research and people would get burns from radiation for cancer is if we did that type of a combo therapy, because glutathione uses lots of nutrients just to keep cycling so it can help you heal, it was way better than just giving glutathione, right? So they get the benefit of the nutrient bag first, which is, and I won't get too specific, but the B vitamins are in there, a small amount of vitamin C, and we'll talk about vitamin C in a minute. There's going to be all of the expected minerals in there that are cofactors for healing, et cetera. And generally, that's it. There might be a few amino acids, too, for the healing process. Then after that, they would get the glutathione. Now, in a more complicated case, or as one of the cases actually presented at a big hyperbaric conference, trying to show hyperbaric doctors that they could use this synergy. And most of them hadn't thought of this. We did a case with a patient that had a very bad motor vehicle crash and a traumatic brain injury. And so they were doing an acute TBI protocol at our clinic for the hyperbaric. They would get out, they would get the nutrient bag, like I said, glutathione, and then as a third IV, they would also get phospholipids. Now, in different countries, they're called different things, but phosphatidylcholine is it's a complex molecule called a phospholipid because there's a phosphate head and some fat. Your brain has a ton of that in there. Your nerves do too. So in a brain injury, we often would put that as a third support. Okay. But what we showed in this young man, and we used a standardized TBI assessment tool, was that in looking at his TBI assessment scores, and he did the scores every time he came in. Okay, we were able to progress this young fellow who had he had he had lost lots of his memory. He couldn't handle any extraneous light or noise. I mean, all the kind of things, a pretty bad TBI. So his symptoms went down at a rate that was about 4 times faster than you would see just with hyperbaric alone. So the fact that we were able to synergize the hyperbaric benefit with a bad TBI, now it was real. I mean, it was horrible that the man had the car accident, but it was great for research purposes that we could get him to an acute protocol. It was wonderful to see that by doing this and then adding this nutrient protocol after, we could speed up his healing. So I mean, he still needed a fair amount of treatment, but the speed at which his scores improved for memory and pain and all the things was 4 times faster than just with HBOT alone. And HBOT alone is amazing. Okay. So that's one direction. And so I would do that for, motor vehicle accident, healing from surgery. We did this actually a lot with, I don't know who the first one was, but then it sort of caught on. Women would do it after hysterectomies because it's a lot of healing and they're busy and they're a mom and they want to heal as fast as they can. We did a lot of post-hysterectomy, but really any surgery. as I said, oral surgeons, they loved it because they want their patients to heal as quickly as possible if they have to cut a nerve, et cetera. So you kind of get the idea there. But the HBOT kind of the same. It's doesn't change for either direction. The nutrients on the injury side are all aimed at support the natural processes that let me heal anyway. My body uses natural things to heal. Support a primary antioxidant cycler that we have called glutathione, which glutathione, as soon as you put it into a person, sucks up a whole bunch of other nutrients just to operate. So it's really good for us, but it also can actually deplete you of other nutrients. So those nutrients we put in the first bag help me heal at the cell level. They also help the glutathione work. And then in a real, a bad neurological case, we might do some phospholipids too. And all of those then are going to swim in the same direction, chemically speaking, for healing, right? So then if the other direction still has hyperbaric, what would we do different if a person has acute infection or cancer or something in the immunological world? Okay, that's the difference is not the hyperbaric really. It's going to be what you would do with IV. Now there are times where there's exceptions to what I'm going to say, but generally speaking, for treatment and the cancer milieu, acute infections, or even our chronic infectious patients. You get a chronic Lyme patient or someone has Epstein-Barr that reactivates. So it doesn't have to be acute infection, but we did a lot of that. In those cases, what you want your immune system to do is, again, take advantage of the hyperoxygenation that you just put inside of the person. And what I would explain to people, although I know it's a simplification, but that sometimes works the best explaining things to folks, is hyperbaric is really interesting and it's such a cool tool to use because it sort of has this kind of sine wave effect in your body. And so the upswing of the sine is more of an oxidation that your body goes through because we fill you with oxygen. And then that naturally, even if you just do the hyperbaric, that naturally turns your body on to say, whoa, I just got all this oxidation going on, upswing. Now I'm going to have this downswing, and I'm going to pump out a bunch of natural antioxidant, okay, to balance, right? In the case of a cancer or infection, et cetera, we want to extend the life of the acute upswing, the oxidative part, right? So we put them in the chamber, again, no difference there. But when they get out, they would have an IV that would support oxidation, an oxidative therapeutic IV. That's a spectrum, but the most common ones people know about are high dose vitamin C. So remember we said in the healing one, we put a little bit of vitamin C. That means, say, 2,000 milligrams, 3,000, that's low dose. High dose might be 50,000 milligrams, 50 grams, 75 grams, 100, big, right? High dose vitamin C is one. Ozone is another one. And then depending on what part of the world you're in, there's a lot of oncology clinics that will combine a plant medicine called artesunate or artemisinin, and then high dose vitamin C because they synergize one another. So they might do that too. But the purpose of that is to take the upswing, which is oxidative, and make it plateau for a longer amount of time before it dips back down, which of course eventually we want it to dip down because you can't oxidize somebody forever and ever. But it's taking the oxidative benefit of the hyperbaric and making it last longer, okay? And we do definitely see synergy with the other oxidative, say, IV therapies and hyperbaric And in my opinion, they work better in a cancer setting for that purpose. Now, I did say there's exceptions. If the reason you're getting it is because you are treating a side effect, like radiation burns or some side effect of cancer, that's a different issue. But most of our patients are trying to do integrative things to help their body fight with the cancer, help their immune system be as anti-cancer as possible. And there are times where this oxidative extension is really useful in cancer and also infections. Those are the two big ones there.
Excellent. This is art. It's science, but I think it's more art of medicine even than science. What happens? I thought about fibromyalgia because in fibromyalgia, they already have such a high level of oxidative stress that sometimes hyperbaric therapy is just too much for them to take. How do we support these patients with an IV therapy?
Yeah. So that's a really, really good question, because now that we know the two directions we can kind of go, it underscores what I think a lot of the more experienced doctors with, say, fibromyalgia patients or chronic Lyme disease, other things like that, who would refer for hyperbaric. Most of them do it, and of course now more people are getting chambers, but back then most people didn't do it. But they would say, well, we always tell these people, give it 3 dives, 3 hyperbaric treatments before you judge, because sometimes the first one might aggravate you a little bit, and that's because if you get someone with chronic fatigue syndrome, fibromyalgia, sometimes long COVID is this way. Some of your autoimmune patients can have this happen. There's a whole collection of people that are under oxidative stress, toxic people too, right? So what we found was that, this is going back, let's say 10 years ago, the 3 dive rule was nice because they'd say, oh, wow, that first one, not so bad. Second one, maybe we went a little longer, and maybe I felt a little achy the next day, or some symptom. Sometimes the third one, it was more of the same. Sometimes the third one, it was like I actually felt better, so they kept going. What we sort of worked on as the next step was, until we understood what their body was asking for, and everybody, you can have one diagnosis and 10 people with the same diagnosis, and their body will ask for 10 different things. So it could be an autoimmune patient, it could be fibromyalgia, whatever. And a lot of it depends on what else they're doing, with their care. So what we started to do with those folks is we assumed they were probably dealing with too high of an oxidative load, whether that was from toxicity or infections or whatever. And so we would treat them more like the first thing I described, which is the injury model. A patient who's had no support, we're going to treat them like they're really oxidized already, and just be real nice to their body, and then they'll get to the point where they might, level out, and then it's time to take on the chronic infections or whatever, and they're ready for, the other pathway. So, and in autoimmunity, it's a similar sort of a mix. The autoimmune body, the immune system in the autoimmune body is, it's lost some or a lot of its modulating ability. You still have an immune system. It's either overreacting in one place or underreacting in another. And so again, if there's nothing being done to treat that, to help your body get back in balance, and you just put them in, you put them in an oxidative environment, sometimes it's too much right away. And so they'd be like the first group of fibromyalgia patients I talked about. But then sometimes when you've worked on the other things and all that, as you and I know, and we talked about, I think, once before, You can have some chronic infectious things that can definitely drive autoimmunity. If you got that balance going on, then it's time to try the oxidative pathway. So again, there is a lot. I mean, all good medicine is art, right? And so there's a clinical art to sort of deciding which direction you go. But the way I try and describe it to doctors, but especially with patients, is there are times when your body just needs us to be as kind as possible to it. So we've got a real powerful therapy in hyperbaric, and we can synergize it and make it more comfortable for you by doing this one pathway. Let's do that. Let's be kind to you. But if we already have done all this work and your body is in better shape and tougher, but we've got some big, hills to climb, like a chronic infection or some other thing, then let's extend that oxidative, burst, let your body really participate in that immunologically, and we can push it that way too. And I always tell people, look, your body is the only thing that knows the answer to these questions. So we won't know till we do it. And if it really didn't work out well to go one direction, we'll try the other direction. And that's probably what your body's asking for.
So to summarize, it doesn't really, not that it doesn't matter, but it doesn't make that much of a difference whether you do it before a hyperbaric treatment or after a hyperbaric treatment, as long as it's done within half an hour of another treatment, and doing it after is way more comfortable for the patient.
It's way more comfortable. And there's actually calculations depending on, how long your dive was, and pressure and everything. You have, because we get this question from people maybe in more rural areas, and it's like, well, I've got hyperbaric here, and then I've got a 45-minute drive, to get over to get my IV, which is closer to my house or whatever. We generally will tell people that they've got a window of about an hour and a half or so. The real window is longer. But when at an hour and a half, you're getting a diminishing return. Now, another issue is if it's that far apart, then the order that they go in doesn't matter as much, because you're not running the hyperbaric right into the IV. So then you almost can take the closest one first or last, but if it's within, 45 minutes, certainly, but up to an hour and a half, if you live rural and you have to hit the IV on the way home, you still get benefit. Yeah.
But what really matters is what's in that IV.
Yeah. Yeah. The nutrients that are there are critical. Yeah.
Because we want to exercise the art of doing medicine, and also it's a personalized prescription, really, which can change even for that same patient, depending on what goals which goals we set with this patient at the moment. As you've described, for the same fibromyalgia patient, we can go either route depending what we're trying to achieve and whether the body can support that. And sometimes we don't know until we tried. We can hypothesize that, well, maybe you're strong enough. So let's add to that oxidative sort of treatment. But we never know. And I know so well what you're describing, because I've seen it not only with hyperbarics, but also in traditional Chinese medicine with herbs. For example, we can create a lot of oxidative stress, and especially when we're treating an infectious disease. And whether our body can take it or not, that's another story. And how do we support this body? So this particular person, so they can maybe still take that treatment. I had a question. Now, you've mentioned that glutathione needs a lot of cofactors in order to be recycled and sort of made inside the body. So we know that hyperbaric therapy stimulates internal glutathione production. So what if we routinely sort of give, if a person is already getting an IV, we're going to get that IV with minerals and vitamins and cofactors for glutathione to increase that effect of internal glutathione production in HBOT. Would it work? Something like that?
Yeah, it would still be beneficial to do that first bag that has the nutrients, the cofactors, because yes, your body under the initial oxidative surge is, remember, because the downswing is antioxidant surge, your body says, oh, more oxygen, we must need more glutathione, et cetera, vitamin C. It'll be even better whether you got the glutathione just from the HBOT dive or the HBOT dive plus a little glutathione after your IV. The idea is, especially with intravenous glutathione, it can go in and it will cycle as an antioxidant. And if you run out of cofactors, it's done. And it actually can become a pro-oxidant. And that's why when we started to look at people, especially with, injuries and damage and things, we wanted to keep cycling around. Your body naturally will do that. But these cofactor nutrients, which include common things that we all know about, such as zinc and selenium, some trace minerals, vitamin C is very needed. Vitamin B5, B3, and B2 are all needed. And there's a couple others in there too. So we generally have all that there. And so even if you stop there and let's say the clinic ran out of glutathione that day, you're still going to get the boost from the hyperbaric anyway. It's just for people, especially with the acute injuries, right after surgery, or acute head trauma, it really seemed to even be better to add a little extra glutathione. Yeah.
Got it. Thank you. That's the nitty gritty of it. I like this little nuances because it really what makes up the difference.
I think you bring up an excellent point on the other pathway too, because someone now might be thinking, well, wait a minute. If I have cancer or I have a viral infection or some other reason why I want to do oxidative treatment, isn't that bad if the hyperbaric makes my glutathione levels rise? The short answer is no, but here's why we do it the way we do it. In the cancer or viral infected person, remember, we want to keep the upswing high longer, and we do that by giving ozone, vitamin C, high dose, etc. What aren't they getting in that? They're not getting the cofactors to start cycling it until we go into the downswing and the body makes it themselves. So it's still getting the benefit, but that's why you don't do those nutrients on one side of the ledger and you do add them on the other side of the ledger. Yeah.
Got it. Interesting. That's really interesting. I can talk about it for hours. So that brings me really to the next question. Those are IV, and as you mentioned, IV are done in a controlled setting. In a way that practitioner has to do an IV, it's very difficult for the person to do IV themselves. They know exactly what is in that bag. It's controlled, and also there is a direct absorption. So we're not going through the gut, we're bypassing that. So there's 100% absorption really. But there is also another form of supplementing, which taking supplements orally in a capsule form or liquid form or whatever form. And as we talked a little bit about before recording this podcast, this is the most self-prescribed therapy out there, is supplementing with all kinds of things. And many times people self-prescribe or they were prescribed by a practitioner. Some patients come in with a list, like never-ending list. I just had a patient, a 12-year-old boy on autistic spectrum, and his mom brought a list of the supplements that were prescribed by 3 other different practitioners. It literally took me 5 hours to get through the list. It was such a long list. And here we're getting into polypharmacy. Doesn't matter that those are not medications. Those are not pharmaceuticals. Maybe they're nutraceuticals, but there's still a lot of them. So people supplement. Problems there that the industry is not regulated. We don't know exactly what's in a capsule form, especially if it's over-the-counter supplement. People take those long lists or many capsules before, after hyperbaric treatments. What do we do there? Like, how do we sort of make sense out of it?
Yeah, it's a excellent follow on. And I think we were talking about this before we started recording. Another factor in this is a lot of times, just because they don't think of it as something that could medically affect them, a lot of people just forget to tell their practitioner, say maybe doing the hyperbaric or doing all of the stuff, that they're also taking all these other things, right? So at least when they bring the list in, or they bring the bag in full of bottles or whatever, you know what they're taking. But if you don't ask people, a lot of times they might be taking, who knows what, because the internet is good and bad. And one of the things is, if you have X problem, you can look up and you'll get 100 different things that are supposed to be good for X problem, and you might buy 20 of them, And just like the discussion about, the IV is a little easier chemically to think of because it's going right in the body. It's the same sort of art, really, and calculation if you're taking the things orally. It's just that now we have something that really your healthcare provider needs to look at. And, unless the patient's a pharmacist, they're probably not going to be able to figure this out. So the healthcare provider needs to look at, oh gosh, well, if I take by mouth, CoQ10 or vitamin C or my Chinese medicine formula or whatever, roughly how long does that take to get inside of me? It's not going to be like the IV where it gets right in, right? And so because you brought it up earlier, and it's an easy example, let's say, for example, it is a Chinese medicine formula of the type in the infectious world where it is very pro-oxidative, right? We may want that, and we may want that to synergize on the oxidative side of killing some bugs with hyperbaric. But we may not want to do that. Some patients you might do it every day, and some patients you may pulse it. There are Western herbs we do this with as well. And so we will have people preferentially take oxidant type stimulating herbs, if they cancer, infections, etc. And we will have them do it. We'll look at the average absorption time, and we might have them do it the night before and then the morning of their HBOT dive, because we know that's kind of when it's going to be maximally in their system. And then if, let's say, for the example, they're in a very weakened state and that's too much, because, we hear, and I'm sure in one of your other episodes, you've talked about the potential for oxygen toxicity, right? Well, if you take someone who's very weak, or they've just had a big trauma, surgery, some chemotherapies, things like that, and you do this HBOT dive, and then you make the upswing longer with an oxidative treatment, like a IV vitamin C high dose or oxidative Chinese herbs or whatever, you can reach the edge of oxygen toxicity by doing that, because it's not because the therapies were necessarily bad, it's that their body can't respond. They're too weak. So imagine if, and this is actually one of the reasons I've added modules to our classes about IV and hyperbaric, is because they get this call from people and they're like, oh no, this happened, and it was because they did the IV and then the neighbor did the HBOT and they weren't talking to each other, and it turned out it was someone who was way too weak to be given an oxidative treatment right after their HBOT. So it's not like this doesn't happen. Well, then imagine if, through, and it, most people that don't tell you they're not taking things, it's usually just because they think, oh, well, everyone takes supplements or something. But, let's say you don't know they're seeing a Chinese medicine practitioner and they have them on a couple of formulas, both of which tend to push oxidation. And then you just go right on in and you do your hyperbaric and you're wondering why they seem maybe a little oxygen toxic or something. It's so important people know that we need to know what they're taking, and that way we can then do a good job of saying, okay, roughly speaking, these things are going to absorb in this time period orally. If we want them to be part of your HBOT, then we're definitely going to sequence them around that. If we don't want them near your HBOT, we're going to have you take a break, in that time period. It's just a little bit, it's a little more, oral absorption is not as clear and as quick as IV absorption. So you just have to factor that in.
And taking antioxidants might not solve the problem, right away. So probably
Right.
need to give them more binders and things like that.
Depending on what's wrong, yeah, because obviously hyperbaric on its own, if you have someone with a complex chronic illness, which most chronic illness is, the hyperbaric may stimulate the liver dumping a whole lot of, stored up toxin. And some of that goes out through your bile. And if there's no binders around, it just goes right back in your blood and makes you even sicker, So yeah, so it goes back to that, practicing medicine is an art. And part of it is, yes, you might feel very bad, but maybe more antioxidant isn't the reason you're feeling bad. It's because you just recirculated a whole bunch of toxin in your body, so the answer, a different answer to the same question.
So take home message for practitioners, always ask your patient
Yes.
what they've taken, because you might be surprised.
Yeah.
And as I mentioned to you, with hyperbaric oxygen therapy, one of the downsides is that we don't talk to patient as much because patient is inside a hyperbaric chamber, right? And we want them to relax there. So we're not actually standing beside a hyperbaric chamber and asking them questions. So always ask them, maybe like a routine question. Please list supplements that you've taken today before this hyperbaric session or something like that, to have an idea what you can expect given the case of a patient. What are they coming with to start with? Now, that's for a practitioner. That's a little easier because practitioners generally understand how these things react. What are the interactions between the supplements, different supplements and hyperbarics and things like that. But what about a person who is using a hyperbaric chamber at home? What would be your advice then?
Yeah. Well, the first thing is, and I think this would be across the board, as we've said, tell your practitioner what you're taking from any source. Okay. And also tell them who's making it, where are they sourcing it? Because as you and I know, but a lot of the general public doesn't realize, there are some producers of supplements that submit themselves to a lot of quality control, and then there's others that don't. And now that we have online ordering, unless you're ordering from the company itself, you can also have a fake product, right? Which is a whole new issue, of same label, and it comes not from the company who makes it, and it's not what it says in the bottle. So this is why we need to know as practitioners what you're taking, number one. Number two is, if you, in my personal opinion, and I'm sure you're going to agree with this, if you're going to spend the money to get anything, whether it's a Chinese herbal formula or something, straightforward like coenzyme Q10 or vitamin C, something, it is well worth getting it from a company that like someone like us has checked out and make sure they're doing quality control. What's on the label matches what's in the pill or the bottle, etc. And I know some consumers are very sensitive to this, but a lot of people just buy the cheapest version because it's like, well, CoQ10, there's 10 of them offered here. I'm going to pick the cheapest one, right? Well, sometimes the cheapest one is the cheapest because it doesn't have much CoQ10 in it, and the company didn't submit itself to any testing. So I really think that's another reason to have a conversation, is just say, and a lot of us nowadays, because the world has changed so much, a lot of us used to carry like a lot of supplements in the office so you could see them. Nowadays, we do a lot of virtual and we do a lot of other stuff, or as you said, people might be at home. Just at least ask your healthcare provider, who are the companies you trust, and at least get them from those companies. So now leading to the person at home. The first thing I think with at home is you can either inadvertently or advertently put your body on those two pathways we talked about, which we said could either go with IV or oral. If you're doing it at home, then of course it depends. Why are you doing, home care? So it might be a neurological reason, something in maybe the neurodivergent spectrum. It might be an injury reason. It might be cancer. It might be, any number of reasons why you're doing it at home. I really think that because, as we've talked through this, I've tried to make it sound as simple as possible, these two pathways, but there is this art to it. I think even if you're doing these things at home, so you're doing the hyperbaric at home and you're taking supplements, I think it's worth having a meeting with a practitioner that understands obviously they'll understand supplements, but also hyperbaric, and saying, are there some of these supplements I should probably pause, the day, or I do my, hyperbaric, or the day after, or something like that. Or are there, or I've started getting these symptoms when I'm doing my home hyperbaric, and then I'm taking these supplements. Is there a relationship between these symptoms I'm getting and that? And that's where you can't make blanket statements, because that could be any number of things. But really talking to a practitioner that understands what hyperbaric does, and then they can look at the nutrition or the herbs, et cetera, and say, it could be that at your state, you're just recovering from something. This is too much for you. And you should do the hyperbaric and just these two things, or you should add this in, like we talked about binders. A lot of people aren't doing that. They don't realize how much detox we trigger with hyperbaric. So I think that's the way I would look at home use. Is you want, it's a lot like any other thing you do at home that has a health outlet, like the sauna, for example. A lot of people do sauna. A lot of people do great with sauna with no advice. A lot of people, get sick from doing sauna at home because they don't realize there's things they need, that they need to modulate. Yeah.
Excellent. I really want to ask you that question. But are there maybe 3 supplements that would be safe to take with hyperbaric therapy, no matter what? I'm thinking omega-3s maybe, or if a person is supplementing with vitamin D because they're deficient in vitamin D.
Yeah. Generally speaking, things that are going to support your cell health and are not really going to directly manipulate oxidation versus antioxidant. They may play a role, but they're not like directly in there manipulating it. a fat soluble vitamin you may be deficient in. You might be on vitamin D or vitamin D and K2 together because you're deficient. That's not going to hurt anything. You mentioned omega-3s, not going to hurt anything. You might have been prescribed something, another fat, like a phosphatidylcholine or phospholipid mixture, because you're dealing with maybe some neurological healing or some other, some other reason for that, or your heart, etc. That's going to be a lot like an omega, where, it's not an omega oil. It's an oil. It goes into feeding your cells, but it's not going to, the hyperbaric effect is going to be neutral with something like that. It's when you get to supplements, that are sort of beyond the average. So I kind of look at, if you're eating a reasonably good diet and you're taking, say, a multivitamin mineral, those are dosed in such a way where it's sort of like just supplementing what you're eating for food. That's not going to push you one way or the other. But if, on the other hand, you're doing all of that, and then you sit down and you add into that, big high doses of vitamin C, even though you can only absorb so much orally, you can absorb quite a bit orally, it's like, so vitamin C, you might want to ask about that before you do that. But like your multivitamin, multimineral, that's going to be fine. Your fatty things generally are fine. And some people, for example, take a fat soluble vitamin, vitamin E, like Edward. Even though that kind of has a hand in a little bit of antioxidant effect, it's more neutral because it's feeding the cell and the membranes. It's not really floating around like glutathione might or something. So yeah, I would look at it as the more stable the thing is, and or the more it's just required because you're deficient in something, it's probably just fine.
So I think in this cases, you better be safe than sorry, or at least understand what are you doing. For somebody who's using hyperbaric chamber at home, I mean, nowadays there are patients who in some ways are more knowledgeable than their physicians, or at least some of the physicians. So if you're one of those people and you're really researching every supplement that you're taking and the effect it can have on your body, and also understanding the mechanisms of hyperbarics, that's fine. But if it's something maybe that you don't want to dive in, and then I think it's really wise, as you said, Paul, to consult with a practitioner. Although I always encourage to consult with a practitioner, at least initial consultation, to get the protocol, to get the understanding.
Yeah.
We talked about it before. It's impossible to treat yourself, even if you're, I don't know, the best physician in the world. You won't be objective enough.
Yeah, you need someone else's eyes looking at you sometimes, right? Yeah, and I think, to your first point, that is a frustration with patients who have really, maybe they've been involved in doing home hyperbaric for a long time, and they've really dove in and they understand it. And this is why I keep saying, you should consult a practitioner who knows about hyperbaric. Because if a practitioner doesn't know about hyperbaric, they might understand the mechanics of it, but these subtleties, everything we talked about prior to this moment, none of that subtlety will they understand, because they don't need to. It's like, well, I don't do hyperbaric, so why would I do that? And so they might give you the right answer just because they know the mechanics of hyperbaric, but also it's not uncommon for me in a teaching situation with physicians to have them, and they do IVs. Like we talked about, a lot of people do IVs, not as many people do hyperbaric, and they'll have very interesting misunderstandings about hyperbaric. It's like they know one piece of the picture, and so they say, well, hyperbaric does this. And it's like, well, it does that, but it also does these other things too. It's not just doing that. So if you base all your advice around that, you're going to miss the boat on a bunch of things that hyperbaric does. So I do think, and I know it's frustrating because there aren't as many hyperbaric, aware providers, but there's more all the time. And now with, the world of telemedicine and Zoom calls and things, we can find people easier online. And like you say, depending on what's going on, get a baseline with someone who's not you, to say, let's put this together, give it a try. Then if things change, or you want to experiment with your supplements, or you get a fresh injury or whatever, let's talk again, because your body is different now. And I just think that's wise.
I agree. Thank you for this conversation, really, because some of what we said might be controversial in a way, or might not, some people might not want to see it that way. But even though those are supplements and they're called nutraceuticals, and they're pharmaceuticals, which are way better controlled, right? In a way how they're dispensed. But still, with supplements, you can do harm. You can misuse the supplements. By combining the wrong supplements together, you might produce effects that you were not looking for. It's almost like being in a chemistry lab and experimenting with all this nice tinctures and liquids, and then all of a sudden everything explodes. So I'm really glad we brought this up. And it's not a benign thing. You really need to know how to use it. And there are many practitioners, Paul, like you said, there's so many practitioners who understand it. So for people who are listening, I really want to encourage you. If you're hesitant, if you're not sure, get a consultation. Understand those things. It's like going to a lawyer, because we don't know the laws that well. So we go in to consult with a person who does know the laws, and they can give us advice. Why does it have to be different with medicine? Medicine is even more important. I don't know, if you break the law, you might end up in jail, but if you break medicine rules, you might end up
sick.
Down there.
Or worse. Yes.
Or worse. Yeah. Excellent, Paul. Thank you for this conversation. I always love talking to you. I always learn so much from you. And I hope listeners also appreciate your knowledge and experience and expertise and all that comes with it, and your willingness to share with the world what you know and what you understand, because a lot of it also comes from intuition. So it's a combination of everything. Guys, if you enjoyed this episode, please give us likes. It will help other people see this information. And if you know someone who might benefit from this information, please send them a link to this episode. And Dr. Paul Anderson's details will be in the podcast description, as always.